Today we are going to discuss how to treat knee pain using Master Tung method. There are many methods for treating the knee pain, like TCM, auricular, scalp, but Master Tung is the method which is creating fastest results in the knee pain. So today we are going to discuss the various types of the knee pain, sometimes knee pain because of the osteoarthritis. Sometimes knee pain might be because of ligament injury, bone problem. Sometimes knee pain in the medial side. So what is the concept of Master Tung? Today we will be discussing. So let's start. Hope I am audible properly. So number one concept of the Master Tung. If you want to treat the knee, treat the heart. Suppose some person is suffering with a knee pain. As per the Master Tung, you do the acupressure on the point which is connected with the heart, or do the acupuncture. If you treat the heart, you will able to treat the knee. So as per the Master Tung, the heart is equal to knee. So Master Tung concept for the knee pain, the concept number one, treat the heart and it will work on the knee pain. And concept number two, put a point on the opposite side. The person is suffering with the knee pain on the right side, and you can put the point on the left side in that way. So let's start with the most effective point of the knee pain, that is called 44.06. One of the great point of the Master Tung, as soon as we are inserting the needle here or doing the acupressure, deeper acupressure here, whether you do the deeper acupressure or you put the needle on the 44.06, this point having special efficiency for the knee pain. The name of this point is called shoulder center. As soon as you are putting the needle on this point, this is affecting the heart. The reaction area of this point is the heart. So this point is very much effective for the knee pain. As per the concept of Master Tung, this is called same level effect. The meaning of same level effect, we can see the arm here. We can see this is the arm. So this is the upper arm. Then we can see here is the lower arm. Then we can see here we are having palm and finger. So what is the meaning of same level effect? As per the Master Tung, if you are treating the area at the level of heart, it will be treating the heart. So if anyone is suffering with the heart problem, we can choose multiple points in the upper arm. In the same way, if you want to treat the abdominal problem, like you want to treat the liver, you want to treat the intestine, you can choose multiple points in the lower arm because this is located at the same level. And even I want to treat the genital part, like I want to treat the male and female genital problems, I can treat the point found in the palm area. So this is called same level effect. Actually, this explanation is given in the very detail in Dr. 10 balance method. Dr. Ten balance method is explaining about the system of the same level effect. So if we want to treat the heart, we will treat the upper arm. If we want to treat the abdomen, we are treating the lower arm. We want to treat the genital, we will be treating the palm and fingers. So as soon as you are putting the point here on the upper arm, it is affecting the heart. So it's affecting the knee. So in that way, this is the very effective point. The question comes, where this point located? Now we are very much familiar when we are taking the injection. So we are taking injection here only. Generally, when we are taking any injections in the arm, we are taking injection here. So what we are doing when we are taking the injection, we are searching this muscle. This is the deltoid muscle, deltoid. And the center of deltoid muscle, this is the point, which is the very effective for knee pain. So how to search this point exactly? So number one concept, just see the deltoid muscle. At the center of deltoid muscle, where the doctor are giving the injection, that is the exact point 44.06, or the very good point for the shoulder, which is very good point for the heart, because this is at the level of heart. So when you are putting the point here, it will be treating your heart. So this is the very good point for the knee. Then how to find out the exact point? The concept number one, just find out the center. The concept number two, 2.5 tune down. So how to measure 2.5 tune down? This is 2 tune. Then we keep one more finger. Then we will reach on the 2.5 tune down. So from the apex of the shoulder, if I keep my forefinger, the lowermost finger on the 2.5 tune. So this is the location of the point. I will repeat again. If I keep my forefinger like this from the top of the shoulder, we can see there is an acromion process here. From there, if I am keeping, or from the top of the shoulder, I am keeping my forefinger here, my lowermost finger coming on the shoulder center. I can feel the bone here. This is the bone. The name of this bone is the humerus bone. So this point is just in the front border of the humerus bone. Front border. There are two borders. One is the front border, one is the back border. So I can touch the humerus bone. Oh, this is the bone. And this point located in the front border of the humerus bone. So now, number one concept. From the shoulder apex, 2.5 tune down, or the forefinger down. In front of the shoulder, in the center of this deltoid muscle, this is the location of this point. We can stimulate this point. So you can see here. So this is the point exactly. This is the 44.06 point. And when we are needling this point, the half tune needle or 1 tune needle is enough here. So suppose I want to put the needle here. So this is the wonderful point. I will insert the half tune needle. Excellent point for the knee pain. And we are treating opposite side of knee pain with the help of this point. This point is one of the great points for knee pain. So let's see now. When the person is suffering with the knee pain of the both side, then we are asking the person, okay, can you tell me which knee is more painful? If the person is telling you, okay, my right knee is more painful, then we are putting the point on the opposite side. So this is the point number 144.06, or the shoulder center point. We can see this is the wound. The name of this wound is humerus wound. And from the top, we are coming 2.5 tune down, or forefinger. We are putting the point here. This is working on the heart. So definitely it's a very good point for heart. That's why it's a wonderful point for the knee pain. Now, so when the person is suffering with the palpitation in the heart, definitely if the person is having palpitation in the heart, we can use the same point. The meaning of palpitation, when the heartbeat is very, very fast, person is feeling very fast heartbeat or fluttering, pounding sensation. It might be because of stress. Sometimes it might be because of exercise, after the exercise, even because of some medicines. So if the palpitation is there, immediately you can put the point on the opposite side. If the person is having palpitation in the left side, you can put the point on the right shoulder, 44.06, or the shoulder center point. So the indication number 2, it's a wonderful point for the hemiplegia. Not only hemiplegia, but all types of the paralysis. Like when the person is getting the attack of the paralysis, we know on the one side, there is a poor circulation. Sometime in only one leg, sometime in the half body, sometime in only the person is feeling the numbness in the arm. Sometime person is feeling even only in the leg, sometime in whole body. And there are different words. When the person is getting paralysis only in one leg or only in one limb, it is called monoplegia. So as soon as we are putting the 44.06 point, we can improve the circulation. Even the person is feeling numbness in the one leg, we can put the same point. Sometimes person is getting the paralysis of the half body, that is called hemiplegia. We have to put the point to the opposite side. If the person is getting effect in the two limbs, maybe in the two arm or maybe in the two legs, or sometimes person is getting just half of the lower body is affected, paraplegia, and sometimes both leg are affected, quadriplegia. In these all condition, we are using 44.06 point. So that's why it is one of the great point to improve circulation, to improve the power of the heart. We can send more and more blood, and we can send more and more blood to the brain also. So we have seen it's very good for the heart palpitation. It's very good for the hemiplegia, and it's very good for the atherosclerosis. What is atherosclerosis? This is also the condition having connection with the heart and the blood supply. So we know this is the blood vessels. And in the blood vessels, we are having inner wall, right? Inner wall. Inner wall is made by muscle. So inner wall is having wonderful elasticity. That's why sometimes blood vessels can expand and become bigger. Sometimes blood vessels is becoming smaller and getting contracted. So sometimes blood vessels can dilate. Sometimes blood vessels become narrow, because blood vessel is made by muscles, and muscle is having this power of contraction and the relaxation. but due to some reason, due to age, due to some disease, the muscle is becoming harder. Then neither blood vessel is able to dilate nor contract. So this is called condition atherosclerosis. The inner wall of the blood vessels becoming hard, rough. So we can consider this is the pipeline. Suppose this is the pipeline. And in this, from the pipeline, something is going. But sometimes this pipeline becoming bigger, sometimes this pipeline becoming smaller because pipeline is having good elasticity. But sclerosis means now it become hard, it become rough, not elastic. So vein in the need cannot dilate, vein in the need cannot go in the contraction. So inner wall of the blood vessel become hard and rough. It is called atherosclerosis. The meaning of sclerosis means hardening. So when something become rough, okay, then what will happen? If the thing is smooth, so everything will slip, like blood RBC will slip from there, WBC will slip from there, cholesterol will slip from there, nothing will stuck there. But when the inner wall of the blood vessel become rough, then what will happen? So now there is a gathering of cholesterol because of the roughness. So gathering. So we can see number one, rough lining, which is inviting gathering of cholesterol, gathering of cholesterol. And then slowly and slowly there is a blockage. So this is the very dangerous condition. Nowadays, most of the people are suffering with the high blood pressure because of this condition. Then you are going to the doctor are giving you the medicine of high blood pressure. How to make this lining smooth again? How to improve the blood vessels? We can improve the blood vessels with the help of 44.06, the same point. So ultimately, we have seen number one, it's good for heart palpitation. Number two, it's good for the hemiplegia or the paralysis. Number three, it's very good for bringing elasticity in the blood vessels. So our target is knee, but definitely in the acupuncture, this is the beauty. You're targeting the knee, but side by side, you are also balancing whole body. So 44.06 is one of the great points for knee pain, and it's also very good for the heart paralysis and for maintaining the elasticity of the blood vessels. One more thing I would like to tell you here. Many persons are getting skin infection on the nape of the neck. And it's a very common with a diabetic person. It's not the good. If this skin infection, especially on the nape of neck, is remaining for longer time, it might be dangerous sometimes. It might be some serious condition. And it's common with the diabetic person. 44.06 also very good. The single point enough to treat this. Definitely you can add more point, but 44.06 will improve the circulation and will remove this product. Why this is dangerous? Because from here, there are many blood vessels going to the brain. So this infection might reach to the brain from the neck. So nowadays, polio is not that much common, but many decades earlier, this infantile paralysis or the polio was very, very common. That time also there are 4 to 5 points has been discovered, very nice points for the poliomyelitis, for the polio, and out of them 44.06 is one of the 1 point. Even other 4-5 point we will be discussing in the upcoming master Tung class. But right now I want to tell you, if some kid from the birth having some defect like the paralysis, defect like the polio, and some defect in the leg, we can improve with the 44.06. It will improve the circulation and it will improve the condition. One more condition here, because we are talking about the 44.06. So 44.06 in the master tongue, this is the wonderful thing. In the arm, we are doing the imagination of whole body in the arm. And when we are doing the upper body imagination here on the upper arm, then 44.06 coming at the level of nose. So it is also very good point for the nose bleeding, right? That is called epistaxis. Epistaxis. So if you want to control the nose bleeding, I will tell you only two ideas. Number one idea. Number one. Number one, what is nose bleeding as per the TCM? As per the concept of TCM, when the person is having nose bleeding, this is due to liver heat or liver fire attacking over the nose, or we can tell attacking over the respiratory system. Then person is getting nose bleeding. In the TCM, what we are doing, we are calming down the liver fire. But here we are treating 44.06 point, and it's a wonderful point for treating the nosebleed. But with that, we are doing one more thing, I will tell you. We are putting the 4 drops of one grass in both nostril, 4 drops. As soon as we put this, we can see immediate effect. I will show you this grass. This is called durva. Many person might be aware what is durva. Durva is the grass which is available in the garden, durva. And we are also offering this grass to the Lord Ganesha during the worship. So we are taking the 4 drops, this grass, you might be aware, Dub grass or Durva grass. So we are putting 4 drops Durva grass in the nostrils, and we are putting 44.06. Only these two methods are enough to reduce nose bleeding. Now coming back to our knee. So as per the clinical experience, if we are putting the 44.06 point, it's a wonderful for especially medial knee pain. The person is having knee pain on the front side, on the back side, on the lateral side, but this is the point which is useful for the medial knee pain. And we have to put contralaterally opposite side. Let's talk about the knee pain, kneecap pain. Kneecap, what is kneecap? We can see this is the knee joint. In front of the knee joint, we are having one bone. This is called patella bone. That is called kneecap, right? Many times person is suffering with the pain in this patella bone. So that is called kneecap pain. How can we treat using master tool? So what we have to do, number one, we have to add the point 44.06 contralaterally on the opposite side. And number two, we have to insert the 2 point on the same side. That is called liver 2 and the liver 3. We can see liver 2 and liver 3. Enough done. In the master tongue, we are going to discuss during the discussion of 66 point unit. In the master tongue, we are telling it 66.03 and the 04. So as soon as we are putting these 2 points, liver 2 and the liver 3, they are the wonderful point for the patella bone. I would like to tell you one more thing here. Look at here. I have conducted many workshops. If the patient is complaining the knee pain in the front side, knee pain in the front side, because knee pain might be in the front side, knee pain might be in the back side, knee pain might be in the medial side, lateral side. So right now I'm telling the person is having knee pain in the front side, in this patella bone. We can see this is the bone, patella bone. Or not only patella bone, anywhere in the front side. If the person is telling you that I am suffering with a pain in the front side, okay, this knee is paining. I will put my needle on the opposite side, 44.06. And liver 2 and the liver 3 on the same side. You can try this point immediately within less than the 5 minutes. Person will be feeling wonderful. Let's see where the liver 2 and the liver 3 located. So look at my feet here. You can see here, we can see this is the thumb, great toe, this is the first toe. In between, we can see this is the gap. So from the bay margin, if I go half, then from here, if I go 1.5, so there are 2 points, 1 point half tune proximal, 1 point from here, 1.5 tune proximal or 2 finger. So this is the location of liver 2 and the liver 3. Now we are using these both points on the same side. And 44.06 on the opposite side. So if I needle these 2 points on the same side, we can see the effect will be created immediately. So let's see how can we needle. So first I am needling this point, liver 2. You can see this is the liver 2. Half tube needle insertion is enough. And this is the liver 3. Liver 2 and the liver 3. We can see here. As per the master Tung, in the human body, there are 2 points which is the great point for the heart, that is liver 2 and the liver 3. So as per the master Tung, these 2 points has told the name of these point is fire master. Fire master. Suppose someone is having too much fire in the body, too much heat in the body, too much fire in the body, liver 2 and liver 3 will reduce the fire. And if someone is having knee pain in the front side, like I told you, the pain in the kneecap or in the front side, 44.06 on the opposite side, and liver 2 and liver 3 on the same side. In the master Tung, there is no concept of tonification and sedation, but I will tell you, suppose you are not confident in needling, even you do acupressure, you can apply the few drops of oil and do the acupressure here. Even person is going to get very good results by the acupressure. So liver 2 and the liver 3 point and 44.06. These points are very good point for the pain of the kneecap, so let's see once again here. Liver 2, which is half chin, proximal. liver 3, we can see near the union of these two bones, and 44.06, this is on the opposite side, and these 2 points will be on the same side. Wonderful point, if the person is having pain on the kneecap, means frontal knee pain. Now suppose person is having problem with the ligaments. Now this is another condition. In the knee, we are having multiple ligaments. We are having anterior cruciate ligament, posterior cruciate ligament. There are many ligaments found in the knee. Sometimes person is getting ligament injury. The ligament injury is very common with a person who is playing sports, and even in the old age, person falling down and getting the ligament injury in the knee. So any ligament injury, then how can we treat? As per the master Tung, if the person is getting ligament injury, he will be feeling discomfort. If coming downward from the stairs, walking downward from the stairs, he will be feeling very much difficulty. This is a sign of ligament injury. So 44.06 point on the opposite side, enough. We can needle the 44.06 on the opposite side, it will be working very nicely. This is a very good point for the ligament problem. Okay, so ligament problem is over. Now let's talk about the problem. Person is suffering with a problem in the knee bone. Knee bone. Suppose some knee bone is having degeneration or some problem. There are lots of bone. One is the bone on the upper side, that is called femur bone. Two bone on the lower side, that is tibia and the fibula bone. One bone in the front side, that is patella bone or the kneecap. So the multiple bones found here. And if there is a problem with the bone, maybe there is a degeneration of the bone, then what to do? So definitely, when the person is having this problem, number one, the sign when the person is walking up from the stairs, will be feeling difficulty. So we can find out even with the sign and symptoms. Okay, patient is having very much difficulty if climbing the stairs. This is the bone problem. So the first point will be 44.06, and with that we are going to add 2 more points. All the points will be on the opposite side. These 2 points will be, we can see 22.01 and the 22.02. These both the points found in the palm. We can see here. We can see the location of both the points here, 22.01 and the 22.02. So 3.44.06, 22.01, 22.02, all the 3 points we are going to put on the opposite side, and they will be treating the pain of the knee bone. So where these points are located exactly, 22.01 and the 22.02. If you look at my palm, if you can see my palm, you can see the natural crease here. There is a natural crease here. In the astrology, this is called Mangal Rekha, Mars line. We can see this is the line. In the astrology, this is the concept. If you are having this line, it's a wonderful line. because it's supporting your health Mars line, the additional support of your health. Okay. You know that these all lines is having special meanings, right? This junction of these two lines. We can see one line is going downward, one line going. The junction is having connection with the respiratory system. We can see the marriage lines here. They are having connection with the urinary system, urinogenital system. And all the lines. So in this way, we are telling this line. So on this line, if we go one chun, then we are having point number 1. And again, one chun, we are having point number 2. So from this, we are coming one chun, we can draw 22.01, again one chun, this is 22.02. These 2 points are wonderful point, and they are treating the problem of the bone. We can put the 2 needle here. Even we can put the seed of chana, gram seed. Or even we can put the green gram here on the opposite side. Or we can do the acupressure here. We can do the acupressure here, right? So these are the point 22.01 is one chun away. Again from there, one chun away, that is a 22.02. So if the person is having problem in the knee bone, only 3 points, 44.06, 22.01, 22.02 on the opposite side, they are wonderful point for treating the knee pain because of the problem of the bone. So they are also working if there is a slight misalignment of the bone. Yes, definitely, yes. So the problem of the knee bone can be treated by 44.06. With that, 22.01 and 22.02, these 3-point combination. Now let's move to the next point. Sometimes person is getting the problem in the popliteal fossa. This is the back part of the knee. Back part of the knee or the popliteal fossa. Popliteal fossa or the back part of the knee. Injury of the back part of the knee or the popliteal fossa. So when person is telling that suffering with the knee pain, we are asking, okay, tell me, do you have knee pain on the medial side, inner side? Do you have pain in the front side on the kneecap? Or do you have pain in the back side? Accordingly, we are doing the plannings. And if the person is having knee pain on the backside or on the popliteal fossa, the first point will be 44.06 on the opposite side, like on the opposite side. Then the second or third point also will be on the opposite side. The second point, that is called lingo, one of the very famous point we can see here. This is the location of lingo. 22.05 will be on the opposite side. And the third point, that is called lung 5, also will be on the opposite side. Just the 3 point will treat the pain which is happening on the back side of the knee. If we talk about the lung 5, Why the lung 5 treating the pain which is happening in the backside of the knee? This is the question. So now we can see here, as per the 10 balance method, this is clearly explained. The Tai Yang will having very wonderful relation with the Tai Yin. They are balancing each other. They are treating each other. Tai Yang and Tai Yin. The meaning of Tai Yang means small intestine and urinary bladder, and the meaning of Tai Yin means lungs and spleen. So they are balancing each other. A small intestine balancing spleen and urinary bladder balancing lungs, and they are balancing each other. So how the lung 5? Here we are putting the needle on the lung 5. So definitely it will balance the UB. So as soon as I put the needle on the lung 5, it will immediately balance the UB. Any pain found in the UB channel will go away. We can see the popliteal fossa means bladder 40. The back part of the knee means urinary bladder meridian. If the person is having pain in the backside, this is because of the weakness of the lung, hypofunctioning of the lung, because lung is having connection with the urinary bladder. So the person is having pain here, will treat and the same location on here. The person is having pain in the knee, will treat in the elbow. Elbow and knee look similar. In the Master Tung has given different name. He has given 33.16. So the person is suffering with the knee pain in the popliteal fossa on the back side. We will be adding 44.06 plus lung 5 or 33.16. But one more point is adding lingo. Lingo is very great point, lingo. Lingo point located. We know this is the bone and this is also the bone. On the junction of these two bones, this is the location of lingo. So as per the Master Tung concept, any bone is doing the representation of whole body. So the upper part of the bone is doing the representation of the upper body. Middle part of the bone doing the representation of the middle body. Lower part of the bone doing the representation of lower body. So when we talk about the bone found in the palm, so look at this bone. So this bone is doing representation of the whole body. This is the tubular bone, long bone. This bone is doing the representation of whole body. We can see the head and we can see the lower part. Even this bone is doing the representation of the whole body. This is the head and this is the lower part. So this is the union point of these two bones. This is called lingo. It will be treating each and every problem which is happening in the lower part, whether the lower back pain or the knee pain or the heel pain, any problem which is happening below the lower back, tailbone pain, knee pain, calf muscle pain, heel pain, any pain, We can treat with the help of lingu. Lingu, one of the great points. So sometimes person is suffering with the knee pain. Might be person is also having some problem in the lower back and getting the knee pain. So we can treat lower back pain as well as the pain of the back side of the knee. So now, if the person is having injury of the popliteal fossa, how can we treat? The number 1.44.06 on the opposite side, lingu on the opposite side, and the lung 5, we already have seen lung is balancing urinary bladder channel. On the opposite side, with the help of these 3 points, we can treat the problem happening in the popliteal fossa. Only 3 points. Now let's talk about the medial knee pain. Definitely 44.06, one of the great points for medial knee pain. But do we have some more point? Because medial knee pain is more common in most of the person. Medial knee pain. The medial knee pain means when the person is having pain in this inner side.